All right, so everyone, in today's lecture, what we are going to specifically do, talk about the autoregulation. And this autoregulation is revolving around the renal blood flow. Okay, and previously, as you know, that we have already understand how filtration actually occurs in the glomerulus, right? And what determines the glomerular filtration rate. So the next important question that we should ask is something very practical. Think about your daily life, all right? So your blood pressure does not stay constant. This is very much true to all of us. So it changes all the time, and whenever you are standing up, your blood pressure changes. When you exercise, your blood pressure increases, right? And when you sleep, it decreases. So even the emotional stress can increase the blood pressure. So now here is the key question, that if the blood pressure changes so frequently, why doesn't the kidney filtration change dramatically every single minute? So if the filtration increased too much, listen carefully, that if the filtration increased too much, we would lose huge amounts of the water and the electrolytes. So, and if the filtration decreased too much, it means that such of the waste products like urea and the creatinine, as we have discussed today also, would quickly accumulate in the blood, right? So the kidney must have a protective mechanism that keeps the filtration relatively stable even when the blood pressure changes. Okay, so all this protective system is called the renal autoregulation. Okay, so we have to quickly look up to the basic mechanism for all that one, but first you have to understand the definition for the renal autoregulation. So this means that actually the kidneys are able to maintain relatively constant RBF, the constant renal blood flow. This RBF means the renal blood flow, okay, and the glomerular filtration rate despite changes in the systemic circulation of the blood pressure or the systemic blood pressure. In other words, you can just try to remember that even if your blood pressure increases, your BP either increases or it gets decreased, right, moderately, the kidneys try to adjust their own blood vessels. They try to adjust all the, for example, this is the kidney blood vessels. So relevant to the increasing in the blood pressure and relevant to the decreasing of the blood pressure, the blood vessels of the kidney, the BVs or the blood vessels for the kidney, they try to adjust them appropriately to keep the filtration stable. So this autoregulation works effectively when the mean arterial pressure, remember out, when the mean mean the average, okay, the mean arterial pressure, it remains in between approximately 80 to 180 millimeters of mercury, right? You have to remember out that this usually works effectively, this autoregulation usually works effectively when we do have the mean arterial pressure in between 80 to 180 millimeter mercury. So within this range, the kidney is actually able to regulate itself. And outside of this range, however, autoregulation may probably could be failed. Okay. So now the next question that comes into the mind naturally, that how does the kidney do this? You have to remember out that there are basically two basic mechanisms by which the kidney is actually doing this autoregulation. The first one is the myogenic and another one is the tubuloglomerular mechanism, right? And both of these mechanisms mainly act on one very important structure, which is actually the efferent arterioles. Both of these, they revolve around the basic structure that we have learned previously also revolves around the efferent arterioles. And you have to remember that the efferent arteriole is the blood vessel that brings the blood into the glomerular. So by controlling the diameter, of efferent arterioles, the kidney can control how much of the blood can enter the glomerulus, and therefore the kidney or the efferent arteriole is also responsible for controlling the filtration. So now let's just begin up with the first mechanism very briefly, the myogenic mechanism. Okay, while I will explaining up, you will totally understand the whole mechanism that is being looking out over here. So the first thing to understand about the myogenic mechanism, we first need to remember something about the vascular smooth muscles. Do remember that the walls of the blood vessels, they do contain the smooth muscle cells. Okay, that is something histologically that you need to remember out, that the walls of the blood vessel, they do contain the smooth muscle cells. So one interesting property of the smooth muscle is that when it is stretched, it tends to contract automatically. Whenever you are stretching out whenever you are stretching the smooth muscle, okay, it also tends to contract automatically. It tends to contract automatically, right? And this property is called the myogenic response, okay? It is known as the myogenic response. So now let's walk through what happens step by step. Now you can just imagine the scenario that the systemic blood pressure suddenly increases. Let's say that the systemic blood pressure suddenly increases. Because the blood pressure increases, so more blood is now going to push towards the kidneys, right? And the pressure inside the efferent arterioles also gets what? Increased, okay? So what will happen? This increased pressure stretches the wall. This increased in the pressure stretch the wall of the efferent arterioles, okay? And whenever there is a specific stretch to the efferent walls, now when the vessel wall is stretched, the smooth muscle cell in that wall respond to that stretch. So all the smooth muscle cells, they will go up to the mechanical activation, okay? And what will specifically be following up? And okay, one of the key thing that you have to remember that whenever we do have the stretching, okay, of the efferent arterioles, and there is activation of the vascular smooth muscle, so this actually this stretch activates certain ion channels. This is important. Like this stretch over here, this activates certain ion channels, and specifically you can say that this allows the calcium channels, to enter the cell. Why is that? You have to remember that calcium is the key signal that causes the muscle contraction. This calcium is the key signal to do the muscle contraction, right? And so the smooth muscle cells also they starts getting narrower, or you can just simply say that they start getting contract, okay? And when the smooth muscle contracts, the efferent arteriole start becoming narrower. In other words, we can just simply say that this narrowation is also known to be the vasoconstriction of the efferent arterioles, right? Yeah, now because the efferent arteriole is constrict, so less blood enters the glomerulus, and this reduced renal blood flow helps bring the glomerular filtration rate back to the normal state. So the important idea here is that when the blood pressure increases, the afferent arteriole constricts automatically to prevent the excessive filtration. And this mechanism acts very quickly, helps protect the glomerulus from the damage caused by the high pressure. So that is the very first autoregulatory mechanism that you need to remember out based on the myogenic principles, okay? And you have to remember out there is also another one mechanism, that is the tubuloglomerular mechanism, okay? And this is a little bit precise one as compared to the myogenic. So let's look up to the tubuloglomerular feedback. Usually to understand this one, we need to look at the special structure in the nephron. And we have basically learned about the basic anatomy of the nephron, that we do got the juxtaglomerular complex, right? Juxtaglomerular apparatus, right? We do have the juxtaglomerular apparatus, and you can just remember out that this apparatus, it also includes several important components, but the one that we are specifically focusing up is macula densa cells, right? We do have the macula densa cells in the juxtaglomerular apparatus, and you can just simply remember out that these macula densa cells, these are actually the group of the specialized cells located in the distal tubule, okay? So these cells are also specifically positioned very close to the efferent arterioles. And after that, you have to remember out the main function of the macula densas, that their main job or their main work or function is to monitor NaCl. Macula densa's main function is to monitor NaCl concentration. Okay, NaCl concentration specifically in the tubular fluids, okay, into the tubular fluids. And why specifically the sodium chloride? Because the amount of the sodium which actually reaches the distal tubule tell us something about how fast the filtration is occurring. So let's how this works. First of all, you have to remember that suppose we do have a condition in which the glomerular filtration rate, the GFR, it gets increased. We do have one of the, let's suppose that when the filtration is increasing, right? So more fluid is now moving through the nephron. And because more fluid is filtered, so more sodium chloride also reaches the distal tubule, right? And so what after that? Now we have, let's recap first. We do got the filtration increase, we do got more fluid through the nephrons, and because now there is more fluid, there will be more NaCl also. So you can just simply remember that the macular denser cells try to detect this increase. The macular denser cells, they try to detect this NaCl increase, right? The macular denser cells try to detect why there is so much of the NaCl raise up, okay? And these are sensed by the macular denser cells. So whenever they do got this signal that why there is increase in the sodium chloride concentration, so what's the next step? They try to interpret as a signal that filtration is too high. They think that, okay, now the filtration is actually too high. So they send signals to the nearby afferent arterioles, and they start giving them the signals to the afferent arterioles. And these signals are the chemicals actually known as paracrine chemicals, or you can say that the paracrine factors. And these include the substances such as adenosines or the ATPs, right? You can remember out the adenosines or either the ATPs or the paracrine. So these signals, they cause the afferent arteriole to get into the vasoconstriction again, and whenever the afferent arteriole constricts, the less blood flows into the glomerular. So as a result, the glomerular filtration rate decreases back towards the normal. So you can just simply remember out in a whole nutshell or in a summary that the tubuloglomerular feedback works like a sensory system, right? It senses. These macular denser cells, they are actually responsible for detecting the increase in the sodium chloride concentration. So whenever we do got the more increase into the sodium chloride concentration, they get activated, and they do use some of the paracrine factors such as the ATP or the adenosines, right? And these actually goes to give the signal to the afferent arteriole to get constricted, and because of this vasoconstriction, the renal blood flow gets what? The renal blood flow gets back to the normal one. So now you can also imagine one of the specific case where the filtration becomes too low. Now you can just remember. So if now the GFR decreases, what if now the GFR decreases? The GFR is decreases. So less sodium chloride reaches the distal tubule, right? And the macular denser starts sensing this low sodium level and sends signal that causes the afferent arteriole to dilate now this time, right? Because it is just sensing that less NaCl is being going up over here. So this dilation allows more blood to enter the glomerulus, which increases the filtration. And at the same time, the juxtaglomerular cells, they also start releasing one of the hormone that you need to remember out, renin, okay, at this specific site. And this renin starts activating the renin angiotensin aldosterone, the renin angiotensin aldosterone system, ROS, which is also our upcoming lecture, to actually help to restore the filtration pressure, okay? And you can also try to connect it to one of the basic clinical medicine concept before we finish it up, that however certain situations can impair this regulation, but you need to remember out we do have some of the drugs. Actually we can do that in the pathology part also, but you can just remember that we do have some of the medications like non-steroids, anti-inflammatory drugs, right? And these actually sometimes interfere with the kidney blood flow regulation, okay? And another thing related to these specific ones, that these are actually the autoregulatory mechanisms. They protect the kidneys under the normal conditions, all right? That's clinical importance. And both of these mechanisms, they also try to ultimately help stabilize your renal blood flow and also the GFR. I hope so this is absolutely clear.